All right. Hi there. We are hosting another little vaccine education session for any school staff or anybody that wants to learn more about the COVID-19 vaccine. And this one is going to focus on the Johnson& Johnson. So I'm just going to turn it right over to Kyle, and you can go right ahead and get started.
Thank you, Emily, and glad to be back. Thank you for having me back on here to talk about the Johnson& Johnson Janssen Pharmaceuticals COVID vaccine. So for those of you who may not have attended my previous talk, my name's Kyle Massey. I'm an infectious diseases pharmacist at Northern Light Health. I work directly out of Eastern Maine Medical Center as a infectious diseases clinical specialist, and I'm also the program antimicrobial stewardship program co-director. And so previously I presented a pretty large topic on the broad spectrum of how we got from point A to having vaccines and discussion about the mRNA vaccines and what to expect. And so I'm back here today to focus primarily on this new vaccine that's released. And there's a lot of buzz out there about what is reported in the trials and should you get this versus other ones, what makes the most sense, what's best for me. And so the purpose here really is to try to give a little bit more than just what you might find in an infographic on the CDC. So I'm going to dive into some of the details of the trial, but I'm going to try to keep it at a level that's really easy to convey to staff and to friends and to family. Now, I'll say ahead of time that I don't have any financial interest or no conflicts of interest to disclose as I go through this. I'm not paid by the pharmaceutical companies or the vaccine makers. And some of this data I'm going to present is a little bit of an interpretation of what I've found in the data. So when I get to those slides, I'll let you know that the numbers I'm showing you are my calculations from what's available from the studies and from public epidemiology. And the rest of it will come from directly from trials. So the 3 COVID vaccines are now available with different numbers coming from the vaccines. So which one should I get? Now, overall, the Pfizer and Moderna vaccines, our mRNA vaccines, have displayed about 95% efficacy in their trials. The the J&J vaccine is about 74% efficacy, at least in the U.S. arm, 66% overall. Now, it's important to understand that efficacy, one, also means that's how well it worked in a trial without having to worry about a lot of real-world situations. And so we use the term efficacy to talk about these trial numbers. And then after these are in the public and being used, we'll look back to see how well they actually work. And that's called effectiveness. How effective were they in actually presenting the disease once we get out into the public? And so we have a lot of trials that are actually coming out now, several out of Israel and a couple other countries that have showed that these vaccines have maintained pretty good effectiveness, similar to what we're seeing in the trials. So that said, 2 different numbers here, 95% versus 74%. But I think the point I'm going to try to make here is one, these were studied at very different times in the pandemic. And what you essentially get is 2 numbers that you can't put head to head and compare. It's apples and oranges. The second part is, what does 95 versus 74% even mean? Does that matter to me as the individual or matter from our public health responses? So I'm going to start with that second question first. What does those 2 numbers actually mean, and how does it impact prevention of getting the disease and eventually, getting us out of this COVID era? And so this is a model. It's a pretty neat one. You can get this on Reuters, but it's very accurate. It's based on some epidemiologic equations that are out there. You can plug in different numbers for vaccine efficacy and percent of patients who are vaccinated to see what things look like. But I've copied and pasted some screenshots here for you guys so you can kind of see it. And so this big square here, each square on here represents 1 person in the public. The gray are unvaccinated members of the public, and the dark blue are vaccinated. And where you see orange, that's new infections occurring. And so if you take a 95% effective vaccine and give it to 35% of the public, this is what your infection spread will look like. It's not too dissimilar from what we're seeing right now. So very effective, very high efficacy of that vaccine. Sorry, I'm switching up words as I'm talking. Very high efficacy with that vaccine. But if we can't get it out to enough people, overall, it doesn't really take us out of that risk of COVID and out of the COVID pandemic. So if you take a 74% a vaccine with 74% efficacy and 95% efficacy and vaccinate 65% of the population, these are the graphs that you're going to see. And the top one is 74 and the bottom one is 95% with very little discernible difference. And that's because both of these are extremely high efficacy numbers. higher than most vaccines that we've seen in the past 20 years. And so either one of these is going to be a very useful tool in getting us out of this pandemic. And so when you see numbers like 95 and 74%, I don't think of that as a 19% difference. I think of that as two numbers that are both going to work very well as vaccines. And so I don't think there's a lot of weight or a lot of stock that should be put in that from that perspective. And so the second part I want to talk about is just how different these trials were and why we can't even compare those numbers anyway. And so here is a graph. Here are the 3 studies, 95%, 94%, and 66% efficacy between the 3 trial arms. And you'll notice that in these trials, the dates in which they were conducted were very different. So Pfizer and Moderna occurred July through November of 2020 and July through October of 2020, whereas Janssen and Janssen, J&J, had their trial between September and January of 2021. So why is that important? Well, if you take those dates and you put them on a graph, and then you plot how many new cases were occurring during that time frame, you can see with these trial enrollment periods down at the bottom, that Moderna and Pfizer were, while it felt like a very rapid spread at that time, paled in comparison to the 3rd wave that we saw over the winter. And that was really the time frame that the Janssen J&J trial was occurring. And a simple fact with vaccine trials is the higher the rate of background spread of a infection, the more it's going to impact the efficacy numbers. And it typically makes the efficacy numbers start to dip. There's a mathematical and a biological explanation for that. And it's a little more complicated than I think I can effectively tell you guys about within the setting of this presentation. But typically, as you see that case new infection rate rise, a trial that's occurring in a higher rate of infection versus a lower rate of infection is going to show lower efficacy numbers, even if it's the exact same drug that's being trialed, the exact same vaccine that's being trialed. The second part is that the Janssen and J&J study was in very different populations. And so here's 3 pie charts. The main areas that these vaccines were trialed in was the US, Latin America, and South Africa. And these pie charts show you the distribution in each of these trials of those populations. So Moderna was entirely in the US. The Pfizer vaccine was almost entirely in the US with some Latin American and 2% in South Africa. And J&J was a pretty even split between the US and Latin America, and about 15% of their trial was conducted in South Africa. And so why does that matter? Well, you've probably seen on the news that there are new lineages of the virus that are spreading, and they go under a whole ton of different names. But B117, B1351, those are 2 of the more common ones. And there's, for each of these lineages, there's a bunch of mutations that are occurring to the virus. And so if you look at the mutations that are occurring in all these different lineages out there, there's a specific one that seems to be most associated with concerns around vaccine efficacy, and that's called the E484K mutation. And so the B1351 variant, the P1 variant that we're seeing down in Latin America, both of those harbor the E484K mutation, and both of them seem to reduce the efficacy numbers, at least in laboratory studies, of the available vaccines. And so if you do the same thing I did previously, and you put the trial enrollment periods of the 3 vaccines onto a timeline here from March through February, and then you plot the percent of isolates in each of these countries that are testing positive for that mutation. So you get a virus sample, you send it off to a lab, they checked it to see if mutations are present, and out of all of the virus samples they got, this is the percentage of those that came back positive for that mutation. So for example, purple is South Africa, and here in November, about 78% of their isolates they tested were positive for the E484K mutation. And so if you plot these here, you can see there's a significant spread of the E484K mutation during the Janssen trial, whereas the Moderna and Pfizer trials occurred while these were relatively new or unrecognized and much fewer mutations. And so if you take, excuse me, if you take those proportions and you apply them to the time frame in which these patients were enrolled, you can come up with an estimate of how many patients were exposed to these variants where the vaccine may be less effective. So this is my math. but it's based on some sound assumptions, but I wouldn't go, and write home about this per se, but it makes a great visualization. And so if you do that, then you can figure out that over the course of the trial, and on this graph, you have the trial month, so first month of the trial, second, third, fourth, fifth, and sixth for all three of the trials, the proportion of patients who were exposed to these new mutations by the end of the trial was close to 35% for Janssen based on that math. And if you do the same math for Pfizer and Moderna, you're looking at 5% and less than 1%. So the Janssen J&J trials occurred at a time when there was a much higher rate of transmission and occurred at a time when we had a much higher volume of these circulating mutations that may reduce vaccine efficacy. So does that explain all of the numbers? No, maybe not. It's really hard to say. But the takeaway, I think, is you can't take these numbers and compare them head to head. It's just not possible. And this is probably the favorite analogy that I've seen circulating out there in the Twitter sphere. So I found a couple graphics to symbolize that. But here are two folks playing golf, exact same game, very different conditions, and you can't exactly expect that they're going to have the same score at the end of the game. And so the Pfizer-Moderna trial on the left here, and Johnson & Johnson taking a trip with Caddyshack on the right. These numbers aren't you can't compare them head to head, and you can't think of them that way. And at the end of the day, these are all three very highly vaccines with very high efficacy. And one other thing to keep in mind is that the studied endpoints here are prevention of symptoms of COVID-19, not the hospitalization or death or asymptomatic carriage or transmissibility. It's prevention of symptoms, and that's what those numbers come from, the 95% and the 74%. We don't know for sure how different these are in terms of preventing asymptomatic carriage, preventing transmission. From the early stuff that's coming out of some of the countries like the Israeli studies, they seem to be very good, all of them, and likely very similar. And the efficacy for preventing severe COVID, so getting back away from public health and down to the individual, the efficacy preventing severe COVID, hospitalization, and death is very similar between all three vaccines. And the efficacy numbers are very high, all in the upper 80s, lower 90s. And so from an individual standpoint, there's no reason to think that you're less protected by receiving the J&J and the Janssen vaccine. And from the public health standpoint, you really expect these to have a similar impact on the spread of the disease and overall getting us out of this pandemic. So the saying I like to use is when folks ask me, hey, I'm eligible to get the vaccine, which one should I get? I always say that the best vaccine you can get is whichever one is available. And so whichever one is available to you, go ahead and get it. The Johnson & Johnson certainly has a benefit of having a one-time dose. That's a great opportunity. If the Pfizer vaccine is what's available to you and you have to get 2 doses, I would get the vaccine, whichever one's available to me. One other thing that I want to touch on before wrapping up is there is a lot of discussion around whether or not there's any religious concerns with receiving these vaccines. And for those of you who may have listened to my previous presentation, there's a little bit more general in detail. I talked a little bit about where that stems from and why. And so the concern comes from the use of fetal cell derived cell lines for testing and manufacturing the vaccines. There are a couple fetal cell lines that were harvested back in the 1970s that are commonly used in research because they're very easy to store, they reproduce very nicely, and they're great for viral studies. Some of the vaccine manufacturers have utilized those for testing, and some of them have utilized them for distribution and manufacturing. The Pfizer and Moderna vaccines did not utilize them in the distribution and manufacturing, whereas the Johnson & Johnson does. And so the general recommendation that I have for folks when they ask me this is, reach out to your secular society or non-secular society, whatever it is, it's your guiding belief around the use of vaccines like this, and find out what their recommendations are. And most of these organizations out there have bioethicists with already developed information to help you make your decision. For example, most the Catholic dioceses recommend that in a setting where there are no alternatives, it's acceptable to utilize and not a breach of your ethics to utilize a vaccine that comes from fetal cell derived lines. So I recommend you go out to your organizations and have discussions with them to figure out what makes sense for you so that you can make an informed decision when the time comes for you. So that's wrapping up the talk, a little shorter than the last one. But Emily, I'm going to pass it back over to you, and I'm happy to answer any questions if you have any.
I think my question that I just wanted to pose to you is about feeling at what point after vaccination are you fully protected? And I think we talked about that in the previous talk too. And I think maybe some guidance has changed about, what does it mean for me when I'm fully vaccinated?
Yeah, I think there's two parts to think about there too. There is, if we look at the laboratory data of serologic response, how well does your immune system respond and when does it respond to the vaccines? For all three of them, your maximum response probably occurs in the 14 to 21 day range. It's really hard to tell when you're fully protected because it can be influenced by a lot of things. How rapidly is the disease spreading in the background? Are you wearing a mask? What are you exposing yourself to? But generally speaking, for the Johnson & Johnson, around 21 days seems to be when you've reached kind of a maximum response to the vaccine. And so that would be the point where you could start to feel maybe more comfortable and let your nerves, calm down a little bit, being exposed to COVID out there around the 21-day time frame. But as always, continue to follow the CDC guidelines and recommendations for what to do now that you're vaccinated. What activities can you engage in, and what activities can you change?
Great. Thank you very much. I do want to just point out that if in Maine, in the state of Maine, if you are, if you're 14 days past your final dose, so that's J&J is just one dose, so it's 14 days after that, or 14 days after your second dose for either the Moderna or the Pfizer, that like if you are exposed, if you have a direct exposure to COVID case, that you kind of have a free pass as far as quarantining goes. And that's the same for traveling, at least within the United States, when you return to Maine. So, well, thank you very much for doing this, Kyle. I know that a lot of people found that the previous one was very beneficial, and I'll share this with school nurses, and they can share it to their school staff, or you can feel free to share away. We're happy to help spread the word on COVID-19 vaccinations. So thanks a lot, Kyle.
You're welcome, Emily, and I'm glad to have done it. Thanks for having me here.
All right, bye-bye.